Wednesday now. September is Peripheral Artery Disease Awareness Month, and while it is a common condition, many are unaware of it, and in women, it is often underdiagnosed. Albany Med vascular surgeon Dr. Courtney Warner joins us now to enlighten us. Dr. Warner, thank you so much for coming in.
Thanks for having me.
Let's talk first about what it is. Define it for us and explain what peripheral artery disease is and the biggest concerns.
So peripheral artery disease is a condition where you get atherosclerotic plaque or buildup in the arteries that then causes a stenosis or a blockage that prevents adequate blood flow from getting to the leg or the foot.
And that can lead to stroke ultimately?
Well, so stroke would be the arterial disease in the carotid arteries and in the brain. A heart attack would be arterial disease in the heart, but peripheral arterial disease really refers to the lower extremities. It's a lot of people don't know about it. A lot of people don't know that vascular surgeons treat it, but it's a very common condition, especially in women as they age.
So what are the risk factors?
So there are several risk factors, the most common being smoking. It's difficult to quit, but the number one recommendation for smokers is to quit smoking. Also diabetes, high cholesterol, high blood pressure also contribute, and there's a family history component as well.
So obviously to avoid this, right, for prevention, just, that healthy diet, exercise.
Right. There's baby aspirin and statin therapy if you are diagnosed with peripheral arterial disease. And depending on how severe the symptoms are, there are surgical options as well.
So tell me about women and what the concerns are here with regard to women.
So women are historically underdiagnosed and undertreated for peripheral arterial disease. They tend to present later in the course, so their symptoms have gone on for some time and they can have a more advanced presentation. So with ulcers, tissue loss, severe rest pain in their legs that is persistent and doesn't go away. Also, women are understudied in general in the medical literature and within the peripheral arterial disease literature as well. So those are some concerns specific to women.
And we find this so often really not just for PAD, right? That's the acronym here for this.
PAD.
But with so many different illnesses and concerns for women that it's understudied.
Yes, yes.
Let's speak a little bit more about treatment. You touched on it briefly, but give us a little more if you could.
So the cornerstone of treatment for peripheral arterial disease is actually exercise therapy, so walking therapy, aspirin, and also statin or cholesterol lowering medication helps to stabilize the plaque in the peripheral vessels. We also recommend control of diabetes. So if you're diabetic, excellent blood glucose control of high blood pressure. And then depending on the severity of the symptoms, if you get to a point where it's really not livable and impacting your day-to-day quality of life, we have other options from endovascular or minimally invasive techniques to open bypass. And a lot of people in the country are unaware that these options exist, unaware that if you have peripheral arterial disease or these persistent leg pain complaints or ulcers in your feet, that a vascular surgeon is the person that you go to for treatment.
We're trying to spread the word here. So real quickly, I know we've got some symptoms. You touched on some of them, but just what women need to pay attention to and really people in general for PAD, some of the symptoms.
So persistent pain in your legs, that's making it difficult for you to walk and progressing over time. So this isn't necessarily like a cramp or a pain that goes away the next day and you never feel it again, but persistent lower extremity pain causing debility, a tough time walking, and then certainly if you develop any sores or ulcers on your feet, that's a more advanced presentation and usually occurs with pain as well. But those would be reasons to present certainly to your primary care physician, but to seek the care of a vascular surgeon.
It really can be debilitating, but there are options and there is treatment out there, but it's just getting the word out.
Yes.
Yes. Dr. Warner, thank you so much for coming in and shedding some light on this.
You're welcome.
Appreciate
Thank you for having me.
Of course. And remember, you can find all of our Women's Health Wednesday segments online. Head to news10.com. Look for Women's Health under the Community tab. We'll be right back.